energy in the room and to see everybody coming in, and I really do appreciate it. I'm going to ask your forgiveness up front that I wanted to make sure I didn't forget to include anything that I wanted to say this morning, so I am going to use notes as I share some thoughts with you this morning, so bear with me as I do reference that a little bit. But today really is a day to celebrate, and I again thank you all for coming in this morning and for the energy and for the work that you've done, and that's what this is all about, to celebrate and to say thank you, because we began our Destiny journey in the spring of 2015. We actually started doing some improvement work. We actually started, turn the light back on, Mark. We started doing some improvement work even before that. But we began the real Destiny journey where we had a specific blueprint for improvement in about May or so of 2015. And it has been a tremendous amount of work that has really touched every corner of this organization. There's nobody who hasn't been part of our journey together. But I want to start by kind of remembering and going back to say, why did we have to do this in the first place? Why was it important that we went and we've been on this transformational journey that we've been on for almost 2 years now? So why did we need to change? Well, because in a nutshell, we had some really broken processes. We were working hard, but we were going backwards. We had always had great quality care, but at what cost? So we often didn't get paid for the care and the services that we were providing because we didn't have the right authorization, or we didn't have the right documentation, or because our orders were delayed so much that we couldn't send out a bill and it was too late to get paid by the time we got the orders back in. We didn't have enough clinical staff to do the visits that needed to be done. So not only were we burning our staff out working so hard, but at the same time we were struggling to cover cases so that the continuity wasn't there for our patients, and every day was a struggle to get patients to the case so that every day the patients were getting a different nurse. Our costs were off the charts compared to other home care agencies. We simply had too much overhead and too much administrative expense. Our processes were broken, causing a lot of wasted time and energy. And the way we were fixing it, and through nobody's fault, because everybody was working really hard, but we would find a problem, and the way to fix it was to add more resources and more staff to it, but we never got to the heart of what was really wrong and trying to get to the crux and fix the problem at the core of it. We lacked, in many ways, a sense of accountability. I heard this from all different areas of the organization. We struggled to feel like a team, and areas were working in silos, and we lacked really the accountability across the silos of the organization. Our Department of Health audit, both here and in Finger Lakes, also said that we were not working in a collaborative way, in a patient-centered way, that we had a deficiency for not having good coordination across the disciplines of care. So in general, people were working really hard, but we were sliding backwards. Our costs were getting higher, our revenue was going down, we weren't getting paid for the things we were doing, people were overworked, feeling frustrated, and through nobody's fault, working all out all the time, but we weren't making any progress. And we had a loss of $5 million as an organization. So it had to change. We had a burning platform that we had to do something about. So the goal of Destiny, although not easy, was kind of simple and straightforward. We wanted to create a better, smarter, more satisfying way to deliver excellent health care at home. That was the goal. That was the vision, and still is. But Destiny was not intended to be a forever project. We had a very specific blueprint. Now that doesn't mean we don't want to continue to get better, but we had a very specific plan and a very specific blueprint that was what we call Destiny. And it began with our FOSI engagement last May, a year ago May, and they were the ones that came in and said, here's a pathway you can take to improve your outcomes and to improve your organization. So we modified it a little bit. It was a great start, it was a great blueprint, but it wasn't exactly what we thought was the best for us, so we took a few modifications in it, and we then embraced it and we called it, or we dubbed it, Destiny. And that's been the blueprint that we've been working on now for a year and a half. So here we are, about the end, closing out, if you can believe it, the end of 2016. And we can start to celebrate now that we really have completed that blueprint. Now that doesn't mean we're done with our journey, but we've completed the blueprint. And if you let me use the metaphor of kind of the house building for just a minute, we've really put up the structure. The house is built. We have some interior design still to do. We still have a little beautifications to make, but we've done the heavy lifting. And we're now ready to move forward, kind of put a bow on the Destiny blueprint, and move forward into the future to really thrive and grow and continually improve within the home that we've built. So what have we done? Well, we've done a lot. We created a whole new organizational structure that aligns our operational functions with our priorities under what I think is probably the very best leadership team in home care, from executives to directors to managers, and then across the organization. We have now the right size of leadership with the right size of organizational structure. We've created and we've aligned all of that together under divisions that make sense. We established interdisciplinary teams a year ago last week, which allows us to take a patient-centered approach to the care that we're providing. And we moved our CTCs, our care team coordinators, as part of that interdisciplinary process, so that we're scheduling our patients around our clinicians around the needs of the patients, not around the disciplines. So it's coordinated and centralized, and done really great work with that. Again, all of these boards showed that work. We've increased our RN and our therapy staffing so that we had enough clinicians. As we downsized some of the administrative overhead, we increased our clinical staffing, and we've added LPNs so that all our clinicians can work at the top of their license and doing the right things at the right times. We've introduced the role of the evidence-based care coordinators within the interdisciplinary teams, so that we were striving for understanding best practice and delivering best practice care to our patients all the time. And we engaged the support of the university. That was kind of the final piece of this developing this transformational journey. Was through the Destiny project, we identified that there were processes, the things that we were doing to get to our billing, to get to our authorizations, weren't working. And so and FOSI identified those things as well. And so through the university, we got support to go into a year of lean improvements and to begin our lean journey. So I'm just going to take this little brochure, which I hope you all grab one, and read to you the definition of what that meant. What's lean? Lean is leveraging employee knowledge and experience to identify and eliminate waste from our processes so that we can spend more time, effort, and resources on the stuff that matters, especially to our patients, and less on the stuff that doesn't. So that was the journey that we started on as we began 2016 and our lean projects. And that's how we got Freddie. Is she here? Where is she? Oh, there she is. That's how we got Freddie, who has been our champion of our lean project for this year. So we're here now as we celebrate kind of the success of lean and the success of Destiny. And as you look around the room, you can see all the process improvements, and this is just scratches some of the surfaces of some of the work that's happened. But we started with the question, what's the possibilities? How do we get smarter and better? Where are the places that we can do better? And wouldn't it be great if? Wouldn't it be great if we could schedule and assign visits in a proactive, timely, and accurate way so that we could reduce the morning chaos, and we could improve our continuity of care, and that we could get out on our visits earlier in the day? Wouldn't it be great if our hospice program could submit an accurate notice of election within the 5-day window that they have to do, so we can get paid for the hospice care that we provide? What if we could do that? Wouldn't it be great if authorizations were obtained prior to the visits prior to doing the visits that require authorizations, so that we weren't making visits that we were never going to get paid for? Wouldn't that be great? Wouldn't it be great if patient medical orders were accurate and signed and back in time so that we could send out a bill and get paid for the work that we're doing? Wouldn't that be great? Wouldn't it be great if OASIS assessments were documented on time with no discrepancies so that we could ensure we got the right payment for the right acuity of the patients that we're taking care of, and that our quality metrics really show the improvements of our patients, and we continue to grow our STAR measures. Wouldn't that be great? Wouldn't it be great? And wouldn't it be great if UR Medicine Home Care had a culture of continuous improvement all the time, every day, that it was part of the fabric of who we are? Well, we've done all of those things, and we've done them really well. Like I said, the structure's built, we have some beautifications to do, but we've done all those things. And I've said it on several different occasions, or I've heard it on several different occasions. No wonder we're all so tired. We did a lot of work. We've done a tremendous amount of work. And now I want to just take one moment to say, let's applaud ourselves for the work that we've done. Destiny. We can put a bow on destiny. Destiny, the blueprint, the objectives of destiny are completed. We're ready to move forward. But that doesn't mean the journey's over. The journey is going to continue. So it's the beginning of what we're calling now Forever Lean, which means we want to have within the fabric of who we are, continually thinking about how do we do things great? How do we do things better and smarter all the time? And it's not just big projects, because Lean is not just a project. Lean is not a committee. Lean is a way of doing our work. Lean is a way of being. It's a way of thinking. Forever Lean means that we want to continually get better, and that thinking about how we do things smarter is woven into the fabric of who we are. So we built the structure. We now have champions that are in every single department, whose role is to continually raise the flag and say, don't forget, let's think lean, do you have any ideas? We have ever better boards around the whole organization where people can put up their ideas and think, this might be a way to get better. We have a steering team now that is helping to, I keep using the word champion, but to facilitate the ability for us to think lean, to vet new ideas, to remember to celebrate, to support people who want to grow in their knowledge of lean. And we have education programs so that everybody in the organization can get educated on lean. We now really have the infrastructure to go forward and be a lean organization. And we've created a position that is the Director of Performance Improvement that brings quality and lean together with Barb. So we've got the whole infrastructure built. So now we move forward. We close Destiny, we move into Forever Lean, and now I have a request of all of you. My request for you is to embrace it, to embrace our future, to embrace thinking lean, to share your ideas, to be part of the solutions, to come up with new ways of doing things better. And if you have a problem, don't kind of complain about it and stew about it, but get it out there and be part of the solutions and you know, get involved, get on a team, get educated, be part of, and continue to be part of the journey that we've been on. That's my charge to you. That's my hope for you, that every one of you will embrace this and help us move into the future. So we're so close. We are there. We've built the structure. We're starting now to see the fruits of all of our labor on our actual financial results. We're great, as we always have been, as a team. We've built some of that accountability. We've built that teamwork. We've broken down the silos in many, many ways. And we're this close to seeing it on our bottom line. Not quite there, but we're getting there. So I am so proud to be part of this organization, to be part of the work that we've done, and I'm so proud of you. So I thank you. And so I ask you to continue to celebrate. If you haven't yet, check out all these different boards, and then just enjoy the fact that we've gotten this far, and the journey ahead is great. So.